It's time for The Sequence on JUS News.
I'm Alexandra Roach, and this is The Sequence. Coming up on the programme today, why drug and alcohol addicts are struggling more during lockdown. And we're in Italy, where lockdowns just ended, to find out what it feels like when restrictions are finally lifted. And why are you being asked to spot unusual animals in your garden? Our first story today. Nursery staff across the UK are struggling with the challenges of social distancing. Infants and babies of key workers need hands-on care, but nursery staff don't have much protective equipment. Diane Hocknell, who owns the Village Day Nursery in Wigan, explains the difficulties.
Essentially, you cannot appropriately care for a child at a distance. Staff have aprons for the sort of personal care needs of children. We don't wear masks. Really, if you're feeding a baby or you're supporting a toddler, you really cannot do your job properly and social distance. So our staff really are at risk at managing and working and supporting those children.
Diane doesn't know exactly when the children of non-essential workers will need to start attending her nursery again, but social distancing is proving hard with just a handful of infants there at the moment. When numbers increase again, the risk of spreading the virus will increase too. Drug addiction experts in South Yorkshire say that addicts are at risk due to the lack of help available as a result of coronavirus. In Barnsley, there are not enough mental health and addiction workers to help the people who need it. Meanwhile, in Burton, a cafe run by ex-addicts is keeping their staff at work to help them maintain their routine during lockdown. Conor McGilligan has the details.
The waiting list here in Barnsley, I know it can take some of my clients up to 6 months to be from being referred to mental health to actually being seen and having an appointment.
That's Tom Stevens, the manager from Rehab for Addiction in Barnsley. He says that there is a huge strain on mental health resources. COVID-19 could have a long-term impact on people who struggle with mental health and addiction, and many people could be left dealing with their problems on their own.
People mention that they're using drugs or alcohol, they're not even going to get referred to mental health until they've sorted that out. And it kind of with mental health, it's the chicken and the egg. What comes first? Was it the mental health that caused the drinking, or was it the drinking and the drugs that caused the mental health? And that's why we're finding a lot of the time, like police officers and nurses and doctors becoming mental health workers, us as drug and alcohol workers becoming mental health workers, just because there isn't enough support out there, especially here in Barnsley.
Burton-on-Trent Langan's tea room is usually a bustling place filled with people. At the moment though, it's only serving take-out food. The cafe is run by ex-addicts and it's keeping their staff at work to help them maintain their routine during lockdown. James Hum, who's the manager of Langan's tea room, says isolation can be dangerous.
Once that boredom sets in, it's quite easy for addicts to start overthinking and could end up with people relapsing. So having people come in and have some sort of structure in their day-to-day life while this is going on is hugely important for their mental health and for their recovery.
Addiction centres across the UK are helping people recover and stay on track during these unprecedented times. However, a lack of funding is making it harder than ever for people to access the help that they need. Conor McGilligan, JUS News.
Next on the programme, some of today's other stories in brief. In the same way that there's going to be a gradual lift of the lockdown, we've also been told to expect a phased approach to the reopening of schools. Education Secretary Gavin Williamson took questions from MPs in the House of Commons earlier.
In terms of the return of schools, this will be based on the scientific and medical advice that we receive. We will always aim to give schools, parents and, of course, critically importantly, children the maximum amount of notice in terms of when this is going to happen.
Virgin Atlantic has announced plans to cut its workforce by up to a third. A total of 3,150 jobs are at risk as the airline tries to secure new funding to survive the effects of the coronavirus pandemic. The carrier is majority owned by Sir Richard Branson's Virgin Group. And McDonald's fans outside the south and east of England will be disappointed by the fast food chain's lists of branches it'll be reopening first. The 15 that'll start offering deliveries next week are mainly in Greater London, Essex and Kent. New data appears to show the number of people dying with COVID-19 in England and Wales was slowing as much as a fortnight ago. Figures for the week up to April the 24th show coronavirus-related deaths in care homes are still rising though. And demand for new cars has all but disappeared to a low not seen since the 1940s. Now, many nurses and doctors have been dealing with the mental health impacts of treating those affected by COVID-19. With many nurses supporting patients during the final moments of their lives, the pandemic has been a psychological challenge for many. Our reporter, Michael Saliba, spoke to a few nurses and doctors about how they are dealing with the strains.
The mental health impacts of the current crisis can't be understated, and the effect on health professionals is often overlooked. A nurse on a COVID ward in Devon talks about how she's coping.
I'm almost like having to kind of distance myself from it a bit, just to like cope with it, because if you like think about it too much, it's like a bit too overwhelming. So like we've had like some deaths on the ward, and we haven't been able to have their relatives with them, and I can't like even think about it. It's horrible.
One doctor, the first man in Malta to contract the disease, says that he was forced to delete his Facebook account due to criticism, with people blaming him for catching coronavirus.
At the beginning there was a bit of COVID-19 shaming people, as if we had purposely gone out, got the disease to bring it back to the country. We are going to have a lot of psychological problems in people who might not do so well in isolation. Some are isolated with their families, but some people are isolated on their own. And also the elderly who do not have the disease are virtually housebound. So many 65-year-old and elderly are staying at home, their family are not visiting them because they're afraid of infecting them. So I think that's going to have a certain amount of psychological effects on them.
Nurses have also spoken about being unprepared for what was to come, and that inexperienced nurses were being given duties they had not trained for.
Their first shift, everyone has been so scared, and it wasn't as we had expected. The support maybe wasn't as much as we were expected, and a lot more was expected of us. So the first shift for every person that I've spoken to, there's been almost tears at the end of your first shift. I'm just kind of under the impression that like these are unprecedented times, and we've kind of got to just keep chipping away at it.
Despite this crisis now coming to an end, it may be years before we truly understand the impact of this disease. Michael Saliba reporting for Just News.
Now to Italy, where over 4 million people have returned to work for the first time after 2 months of rigorous lockdown. Italy was one of the first countries to have implemented national restrictions to control the spread of the virus. We've been asking some of the people there what it feels like.
Nel pomeriggio che sono passata per il centro.
In the afternoon, I went by the center and it was full of people. Everyone was gathering and running around the square and down the side streets. It was a beautiful chaos.
Most of the companies start up again with production, and you can see a lot more traffic around, people around. Slowly, we are returning to the normal operation in all sectors, except the commercial, pub and restaurant are still closed.
Mentre ero in macchina, appunto, ho visto...
While I was driving, I saw all these people, and I counted 65 of them without masks. It seems mad to me. It doesn't make sense that one day we're in lockdown and the next people are running maskless in the streets.
The British public have been asked to carry out their own garden surveys to help protect wildlife during lockdown. Scientists have been monitoring the decline of insects over the last few years, but can't conduct their own research from home. Our reporter Zach Hobson asks zoologist Elizabeth Cooper how lockdown will affect the ecosystem.
It will be really, really interesting to see how things differ when we kind of come out of lockdown. I think I'd be really interested in doing some research and kind of looking at how wildlife is reacting compared to, say, before the lockdown, because I think we'll definitely see a difference.
What scientists are trying to focus on at the minute is the pollinators, so bees, butterflies, and those type of insects. Why are we worried about those species at the moment?
So pollinators in general, we've seen a huge decline in pollinators, particularly because what we did see for a long time is that pesticides were being used in kind of agriculture and farming and things like that. And they are absolutely kind of deadly to a lot of insects and therefore a lot of pollinators as well.
At the moment, because we're all in lockdown and unable to leave the homes, we've seen almost an increase in the amount of wildlife that's been coming out of the human environments and stuff. How important is it that the public at this time is able to record data that scientists aren't?
Surveying is something which is always essential because it basically gives us this idea of how populations are progressing over a period of time. And it's kind of our main tool in being able to predict what happens to our populations going forward. Using the public to conduct surveys isn't necessarily a new thing. Obviously, the public are out there and they can do these things very, very easily. There's loads of kind of resources that we can use now. The public could do it on their daily exercise very, very easily.
That was Zach Hobson talking to zoologist Elizabeth Cooper. Now to Brittany Holder for the sport.
Lockdown has seen many of us doing home workouts, going for runs and cycling. But how are professional athletes and coaches coping with this change? Our reporter, Johnny Slater, finds out more.
Craig Fleming is the first-team assistant coach of Southampton FC, who play in the Premier League. The eyes of the sporting world are currently on the league, with furious debates raging over when and if the league should return. I asked him what the hardest thing about the current situation was for the club.
Trying to plan for different scenarios when we don't really have any timescale, we don't have any timeline, so we don't know when we're going to return to training, when the game's going to start, what that looks like, what we can do with training when we return. So just planning for several different scenarios, really. That's probably been the biggest challenge.
He gave an insight into how sports stars are being looked after at the highest level.
Got them into pods of 5 or 6 players. Each pod of players had then a coach, a fitness coach, sports scientist, a psychologist and a physio to work with them. We caught up every day on Microsoft Teams to make sure they were doing their exercises correctly. They had GPS watches so we could track what they were doing and when.
He says there's no doubt what players and fans are missing the most.
Match day, the adrenaline and the excitement of a match day is I think what everybody's missing the most.
Johnny Slater, Just News.
The US women's football team's bid for equal pay has been dismissed by courts. Judges rejected their claims that female players were underpaid compared to men. Our reporter, Eliza McAuliffe, has the details.
The lawsuit was filed by 28 women's national players against the US Soccer Federation. They've been seeking over £50 million in damages under the Equal Pay Act, as the men signed earned 3 times that of the women. Great Britain hockey player Ellie Rhea gives her opinion on equal pay.
Women's sport, we all want equality, but unfortunately the truth of it is and really sort of ridiculous. I find it really frustrating. As female athletes, we're all striving for equality and to be given an equal platform to play on, and it's always going to be a really difficult topic of discussion. Ultimately, it should be equal, and I'd love it to be equal, but we need the sponsors and the media to give it that platform to allow it to be equal.
After having their claim rejected, they plan to appeal the ruling against the US Soccer Federation.
And now the weather. Today continues to be fine and bright with a slight cool breeze. Looks like it's staying dry into the evening but turning cold later tonight with a touch of frost in rural areas with lows of 4 degrees Celsius. It's 3:45. I'm Alex Roach for Just News.
You're listening to Just News.